Hello everyone, my name is Melody Ding. I'm the academic lead for behavior epidemiology and modeling at the Prevention Research Collaboration. Today I'm going to briefly talk about the research happening in our group using secondary data to inform priorities, policies, and guidelines. The type of questions we ask with secondary data, which means we don't usually collect the data ourselves, but based on existing available data, we ask questions about what are the important risk factors that often involve traditional and emerging, more novel risk factors, understanding the relationship between risk factors and disease outcomes. We also are interested in who are at risk at the population level, understanding the prevalence and trends and surveillance work over time. And I'm going to give you a couple of examples here. So in terms of the surveillance work we do, we are interested in defining risk factors and understanding their prevalence of trends over time. And these are a couple of examples from our group. Some of them are based on New South Wales data, others are based on international data. And as you can see here, some are routine prevalence and trend surveillance, and others are during special times such as COVID. And we're not only interested in how prevalent a risk factor is, but also how the distribution changes over time. Hence, we're interested in understanding the inequality, whether the gap has been widening over time. And a lot of this work has been informing important policy reports and priority setting. And in terms of understanding risk factors and outcomes, we're not only interested in single risk factors, but also profiles of risk factors to understand the unique interactions across risk factors. As you can see here, diet and physical activity, and these are all often interlinked within individuals. And we're also moving beyond just typical health risk factors. As you can see here, we're among the first, or actually we are the first in the world to estimate the economic burden of physical inactivity through chronic disease prevention. And we have recently tapped into the genetic space as well to understand the interactions between genes and lifestyle risk factors on the causal pathway to health-related outcomes. I just want to show you some exciting new directions. As I mentioned, we have been a successful group in terms of getting high impact paper published and having real world implications. Some of our work has informed physical activity guidelines, for example, sedentary behavior planning guidelines, informing policies, and continual education programs for health professionals around the world, so we're very proud of that. But we're evolving as a group in terms of branching out to very exciting new directions, and I'm going to give you a couple of examples here. So first new direction is we know that physical health behaviors are important, like diet, physical activity, and alcohol. But one thing that we have been neglecting as a public health field in general is the social well-being aspects. For example, loneliness and social isolation. And in the last couple of years, particularly through the involvement of our talented PhD students, we have really branched out to the social well-being space so that we can get a more holistic view on what is required to live a healthy and fulfilling life. And to us, the social well-being aspect is as important as the behavioral health aspect. And we're starting to integrate all of these holistic aspects together, because at the end of the day, the WHO defines health as not an absence of illness, but rather the well-being of the physical, mental, and social health. And these are some of our examples of our high impact work in the space of loneliness and social isolation. And again, thanks to our very talented and hardworking PhD students. And another exciting new direction for us is to really kind of go beyond defining and identifying problems to offering solutions. So we're using co-design approach to work with academics and policymakers from different sectors and disciplines to co-design the map for physical activity interventions in New South Wales. And some of you guys in the room today were also in the room when we were designing the system mappings. So this is a 5-year project. We're currently in year 2, and moving forward, our vision is that we can create a comprehensive decision support tool so that policymakers can predefine an intervention of interest, and that we can spit out the numbers at the end to really quantify with each different intervention scenarios how much gains that we get in terms of health, economic, environment, and social outcomes. So we're really excited about this project, that we can use our data knowledge towards solving real-world problems and helping decision makers make the best policies. As you can tell here, we're expanding our work so that the risk factors start to include social well-being related risk factors, and we're co-designing policy relevant decision support tools. And that is the current directions of my group here, and I'm really excited to share that with you. And thank you for those who have collaborated with us and contributed to our involvement as a team together. And I want to thank my team and thank my long-term domestic and international collaborations and my funders. Thank you very much for your attention.